Hello, and welcome to the 16th episode of the Doc Talk with Liz podcast. Our guest today is Dr. Hazel Chung-Knight. Dr. Chung-Knight is an anesthesiologist and one of the founders of the Jamaica School of Nurse Anesthesia. She obtained her MD from the University of the West Indies. In this episode, Dr. Chung-Knight walks us through the events in her life that led her to medicine and anesthesia. She also discusses her experience as a woman in medicine and shares advice for those looking to pursue a career in the medical field. Um, yeah, we can just get into, I guess, to start off, like why you decided to go into medicine in the first place, like how your life in Guyana and with great grandpa Chung and great grandma Chung and stuff may have influenced you.
Okay. Well, to start with, I learned much later in life that I was a premature baby. I was born premature at about 7 months of as a fetus, And when I when I actually learned that, I was kind of amazed because at that time there weren't isolates and incubators, so you could imagine what great care they must have had
Right.
wrapping me up with cotton wool and wrapping me because I was so tiny. And I don't even know how the feeding went. But whatever they did, God meant for me to survive, it seemed.
Right.
And what I do know is that my mother, was very happy. She always said to me, "You're a blessing. You're a blessed child." She, when I calculated later in life, she would have been about 24, 21 years old.
Okay.
Because my brother Vincent, who was the older child, he was born when she was about 16 or 17, something like that.
Okay.
And then I came along, the first girl, and mom would have been about 21, right?
Okay.
And I remember this business of her always saying what a blessing I was. However, as but I remember, I don't have too many memories of my very young days, but there was a picture in our house which showed me in some kind of costume. And when I inquired later on, when I saw the picture, it said it was the picture. I love to see the picture naturally with me in this costume. It was a picture with myself and my sister Bernice, who is 11 months younger than I am.
Okay.
She was,
Wow, not much. Okay.
I was born December the 21st, the year before. Yes.
Wow.
Anyway, I was told that I was supposed to be representing Robin Hood, and she was made Marion.
Okay.
And what I remember particularly that I liked about the picture was the little triangular hat with a feather sticking into it on my head. And she was in a beautiful white dress, nicely combed up her hair and so forth, as me and Marion. And my mother loved to sew, and I often, I never thought to ask her about it, but I often wondered if it was a competition she had entered us into, and whether we had won any prizes or something of that nature.
Okay.
Anyway, that I remember. And then the other things I remember is going to school. In
Oh,
those days, you had a slate and pencil.
yeah.
And the school was near to where her mom, my grandma, who would be her mom, lived very close to the school. And I remember the teacher Nichols, an elderly lady at our house. She would have us, the little new children who came to learn to read and write and maths and so on. And I also remember teacher Nichols had the real person that I was associated with holding my hand with the pencil and so on was
Okay.
another teacher. And when I think about it, she had a deformity. I think she must have been a cerebral palsy because
Okay.
she did have this deformity of her hand and her foot,
Right.
right? But she was very good, with holding your hand to learn to write and so forth.
Right.
So I remember this business of going to early school, learning to read and write at Teacher Nichols' school. And then I remember my later schooling was at Smith's Church Congregational School. Now, this was a school, which was a church school,
Mm-hmm.
and I think it was a congregational church, and there was a grave in the churchyard,
Okay.
which was near to the school. And the man, Mr. Smith, apparently was associated with the getting the slaves free, freedom of slaves,
Really?
right?
Okay. Yeah.
So that
Okay.
was the kind of thing behind that particular school, right? Well, I went to that school. I remember my mom now. My mom was very big into education. And later I learned she wanted to be a teacher,
Oh,
but she was not fortunate to be able to get to do that.
right.
She got my brother, then she had me, and of course there were 9 of us in all. No, no, there were 11 actually. There were 11, but 9 survived,
Right.
right?
Yep.
No, she was a very good teacher because she kind of schooled all of us
Okay.
in English, reading, writing,
Wow.
and she did this maths. They used to have a thing where they used to ask you a math, and you had to give the answer as quickly as you could.
Okay.
And she would have us early in the morning. I remember mom would have us up, and she would go through that sort of thing with us. And also, she would make sure when we coming from school, she'll be checking what you did and so on.
Right.
So when I was about, I think I must have been about 11 years old, and I was doing the scholarship exam at that time.
Right.
No, I was, I think 11 was like you used to do it by 12 years old. So I was a little bit young doing
Right.
the exam. Anyway, I did the exam, and that very year they gave an extra scholarship, and I got that scholarship.
Wow.
So
Okay.
now I got this scholarship to go to high school. I would be going to the high school in Guyana is Bishop's High School for
Okay.
girls. Now, as a youngster, I must have known something about the school. You know, in Guyana, we ride bicycles a lot. The place is flat, and we used to, as we got older, we would ride our bicycles to school and back from school and so on.
Right.
Lots of flat roads, and everybody rode bicycles, right?
Right.
So now, at that time, the British, of course, were very, it was British Guyana, and the
Right.
British were very evident in all the high posts in the country.
Yeah.
So the high school had a principal who was an English lady, and lots of British teachers,
Right.
few colored teachers. But I tell you this, and then you can understand what I was thinking at that
Yeah.
age. My daddy was Portuguese and Chinese,
Right.
so he looked white.
Right.
Okay, I do not think that this was in my consciousness. I consciously I wasn't thinking of that.
Right.
Okay, my dad had started from very well. His he started from bottle washing and so into the near the pharmacy, and then with his studies and so on, and so he wanted to be a pharmacist, and finally he did reach that stage where he became a pharmacist.
Right.
And then apparently he had such good leadership skills and such camaraderie with people that the firm, a British firm, very apparently a very well known in Britain, and apparently treated their people very well. They recognized that my father was a good pharmacist and good to run their business.
Right.
So he became the manager of one of their stores.
Right.
So by the time I am talking to you now, I'm about 11 going on 12, and we've moved into a big house, because that is the thing about, because they always, I only know we were always living in big houses because they always provided the housing, and they chose big houses.
Wow.
So my father had made a little trap door that he could go down into the pharmacy when people brought prescriptions, after hours and the place was closed. So he went down with me to the pharmacy to fill a prescription. And we got to talking. Must have been asking me how I felt about having won the scholarship and going to Bishops. And he said, "Oh, Hazel, you have to have an interview." And he said, "Who you want to take to the interview? Who do you want to take you to the interview? Your mom or me?" Thought about it, and then I said, "You."
Okay.
And he said to me, "Why is it you want me to take you?" And I said, "Because you're white." And I can't remember him. I can't remember any reaction from him. Right? I cannot really remember him looking surprised or
Right.
saying anything to me about it. We just moved on. And I didn't even think that it was something terrible I had said. It was just
Right.
that I thought, oh, if you're going to a white school, then the best thing is to go without somebody who's white. You understand?
Right. Yeah.
Anyway, there was no thought about it. I said what was, and that's my problem. I always say what is on my mind.
Yeah, me too.
Anyway, I don't know if he ever told, he must have, I imagine, told my mother my reaction when he asked me the question. And the truth is, I did go for the interview, but I cannot even remember who took me now. I can't
Okay.
remember who took me to the interview. Anyway, that took me into high school, Bishop's High School. And of course, I worked very hard. Now, about that time, I myself do not know why it is that I had medicine came into my head.
Right.
Why is it that I wanted to be a doctor? Okay, I remember just one incident. We were doing, by the way, the other thing I should tell you about my dad. Not only was he a good pharmacist, a good leader, a wonderful father, he had this business. It was in the war days, and our house was like a factory. He was forever manufacturing things that were not available. So I remember it was such much excitement for us children, because he would, for instance, I remember, because of the blackouts and so forth, he made a little triangular wick out of some sort of tin metal,
Okay.
and then he would have a little wick in it. So in the darkness, you could light the little wick and get a little light.
Right.
Then he manufactured Worcester sauce. He manufactured chocolates. Um, he manufactured bags. He manufactured lots of things.
Right.
Lipstick. I remember lipstick. I don't know what I remember the lipstick, because children, we would be using the lipstick to check it out and so on. So that
Right.
was something was always being manufactured in our house. And it
Right.
is out of that money that he was able to buy us a piano. So
Okay.
that's how we started learning. All of us started, there were only the four big ones at that time. My brother, my big brother, myself, Bernice, and my sister Joan, the one who is
Yeah. Aunt Joan. Yeah.
right. There were four of us. And I do remember now that he has this big manufacturing person. Also, he loves sport. He was
Okay.
always introducing people, the younger people, and out from his workplace and around the area there. He had a football club. He used to take us to boxing. He played tennis, football. He was always into some sport business, right? And so we grew up in this business of sport and so on. Now, the next thing I remember about this business of the medicine now,
Hmm.
I remember I was an older girl I must have been in my teens at that time. We had gone to a concert at the church. We have the oldest wooden church in Guyana.
Wow.
And I had gone to a concert there and getting late with the bicycle riding, and only a little light to carry home. When I saw it was getting dark, I had to go back to where I had parked my bicycle at the teacher's house. No, I never knew she had some bad dogs, and I never knew she let these dogs out at a certain time. So I pushed the gate as usual, and these dogs just attacked me. Could you imagine tearing up a clothes and I bawling and bawling?
Yes,
Anyway,
that that sounds
eventually I
terrifying.
did get bitten, forgot my bicycle and went home. And mommy tried to clean it up and so forth, and they had to take me to the hospital to get the tetanus toxide and so on. And I remember the nurses, kind of saying, now, why did they put ointment on your foot? They shouldn't put an ointment, just clean it up and bring you. Or some, they were going on. I'm saying to myself, to here to put them, keep them in order or something. Talking about, how is my mother to know? She put what she had, right? And I said, I think I should be a doctor, right? And then, however, it was about that age too. My parents were very, very staunch, I have to say,
Yeah.
in their spiritual life. They used to wake us up from small as little children. We had to read Bible verses. We had to go to school on Sunday. We went to school, I can't tell you how many times. We went to
Wow.
Sunday school, we went to church. And listen, they were all religions, because they eventually became brethren. I learned later on that what happened is that when my grandfather, that's my father, when he came to not Jamaica, Guyana. He came from China, and Catholicism was the religion at the time. So
Right.
they were brought up as Catholics.
Mm.
And my mother and father were, prior to their brethren church, they were Catholics. But mommy gave us this story. She said she had to leave the church because a friend of hers got married later in life, and at that time you couldn't go into anybody else's. And she said no God could be a God like that, to say
Right.
that you can't go to your friend's very best friend's wedding because is a different church. And
Right.
then she started reading her Bible, and then something she didn't understand, she took it to the priest, and he said, "Why are you reading that? Only I am supposed to be reading this Bible." And she said she never said anything. She just decided, this
Yeah.
can't be right.
Right.
So at that same time, the Wildishes, who are from Jamaica, they
Okay.
were brethren, and they used to hold these big meetings in the different parts of the Caribbean. And
Right.
both my father and mother went to one of those meetings, and they became converted personally to know the Lord. And after that, they joined the Brethren Church. So we were brought up really as brethren.
Okay.
And they had mommy was at the Bible studies, she was in the Sunday school.
Yeah, she
Daddy was
did
a
a lot of like
preacher, and
did she do a lot
mhm.
of like I think I saw a picture as well of Wickermo Chung, like she would do like a bunch of speaking and stuff as well, like in the church, right?
Yes, yes.
Okay,
And,
yeah,
and
yeah.
when I got older too, she would make sure that I would join those meetings. And then my grandmother, she was congregational and Church of Scotland. But we
Okay.
had a little congregational church right close to our where we lived, maybe about 15 minutes away. So she used to, regardless of what is happening, you're trying to do your homework when you get big, and you're telling us, no, 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 you have to come to prayer meeting. So we got into this prayer meeting thing with her. And in
Okay.
that little church, by that time we learned to play the piano, and we were the organ that used the pedals and thing. We used to play and help them with the singing and that sort of thing. So that's the sort of background that we all had with getting to know the Lord. And I used to be terribly afraid of death. The
Right.
reason being, the reason being, remember I told you there was 11 of us.
Right.
I think I might have been about 9 when mommy had a baby. Because at that time, my midwives delivered the ladies, the women who were
Right.
pregnant at home.
Right.
Mommy had this baby at that same Regent Street house with the manufacturing and so forth. And I remember seeing the baby, hearing the baby cry and all that. And I can't tell you how soon afterwards, whether it's a few days, a week, what. But within a very short time, she was apparently feeding the baby, and something about the baby, I don't know, coughing or something happened.
Okay.
And the baby went blue. And by the time they could call for the doctor and so forth, and he came, the baby had died.
Right.
Right? Now, that was a boy. I think they had named him Peter. I had never seen My father
Yeah.
cried, ball, you would have to see.
Mm-hmm.
Because there was Vincent, three girls, and then I think she lost a baby after June as well. It might have, I don't know much about that baby. But this particular baby, he cried and cried till I can't even tell you if he went to the funeral. But what
Mm-hmm.
I do remember is that when the baby was put in the little white, this is the day of the funeral, baby
Right.
was put in the little white coffin, and mommy made us pick these little, I can never remember the name of the little flowers. They have them all around. But they use it for cancer now. I think is a type of plant that they can use for cancer. And there was pink and white, and she was had us tying them in little bundles, and then we would put it around the little baby. Just look as if the baby was sleeping inside the little coffin there.
Right.
And I remember this thing with my father and the crying. Anyway, that was death before death.
Yeah. Yeah. Yeah.
Second thing about death I remembered. You know, after the flowers, I don't want to see those flowers again.
Right.
The second thing is that my father's mother, grandma, she also was sick. She was Portuguese.
Right.
And daddy brought her to our house because we had the space and mommy could get but those times they could help people to help and so quite easily.
Right.
So she was at our house, and I don't, she couldn't, apparently she was bedbound. She couldn't get out of bed. And we used to go in there and maybe laugh at her, but she was not, I can't remember too much of her talking or saying anything.
Right.
She was there, and I know that she couldn't walk, she couldn't get out of bed. They had problems to try and get her to go out of the house. She would resist it so much just to get a little fresh air and so on. They would have to lift her and take her out. Anyway, grandma died. In those days, you used to have to keep the dead body in your house.
Oh.
So they had to get these big slabs of ice and
Okay.
whatever, and you keep the body there in the house
Wow.
until the funeral parlor music. I don't know if they used to come there. I remember the dead body in the house, so
Can
nobody
imagine.
exactly. Anyway, I do remember them having again her funeral, right?
Right.
And it made quite an impression on me. The other thing is that when I went to school, one of the girls who used to live very far away from the school, riding her bicycle, fell off. I don't know if a pothole or what, and she really seemed to damage her lower limb, or feet,
Okay.
or skin and bone or whatever. She
Okay.
had to be hospitalized, and she developed a septicemia
Yeah.
and died.
Oh my
And
goodness.
so the whole school, of course, had to go to the funeral.
Right.
And just going and seeing this girl dead, that was something else. Now, it made us, there was three of us going to school at the time, the three big ones, myself, Bernice, and June. And
Right.
we were still with our grandma. By this time, my father got another transfer, a promotion, and
Oh.
he's gone up to Berbice, another county away from Georgetown.
Right.
So we, the big ones who used to be at school, are in town, staying with our mom's mother, our grandmother. And
Right.
we had this big bed, and three of us in the bed, and they insisted I must sleep at the outside of it. And
Right.
the minute the two of them drop asleep, I got into the near the wall,
Yeah.
and then they would wake up and quarrel about it and push me back down. And so this thing, the death thing was not something that I really like to face.
Right.
Anyway, thing about it is, we by this time we went to Sunday school, and we are being taught and learning about God and eternal life and so forth. When we moved to Berbice, it was, if you ever see a huge house, that one was massive,
I bet it was.
really massive, right?
Yeah.
And what happened is, we only enjoyed it at holiday times, but we had a huge veranda, and we could go on that veranda and eat crab and so forth, and look out and see the people passing up
Yeah.
and down. Huge veranda, and we could do a lot of things on this veranda with us children. And also we had these big bedrooms, and we had a big kitchen, big living room, really a huge house. And I remember um that while we were there, suppose daddy wanted something from upstairs. This is when
Okay.
it got dark.
Yeah.
I was the oldest one because my brother was at school. He was older than me. He would be at
Okay.
school, in sixth form or whatever. And
Right.
I would have to go up there. Jesus have mercy. It was a terrible thing for me. Anyway,
Yeah.
the
Yeah.
thing about it is I was really, really afraid of this dead business. And anyway, with Sunday school and learning about eternal life, John 3:16, God so loved
Right.
the world and all that.
Yep.
Eventually I was able to overcome it, right? And was more comfortable. I didn't like to go to funerals and go and look at people in coffin.
Right.
I would go through a side door or something and avoid that.
Yeah. Now,
Anyway,
did
that
you
was
get
me.
to did you get to like talk to your parents about your kind of how you felt, your feelings about death? Like, did you bring that up to them?
No, long ago we never. Long ago you never talked like how these
Okay.
present day children talk. You never did that sort of thing. You,
Okay.
you kind of work it out as best you can.
Right.
And then you hear other children maybe in your age group maybe come up and they talk about it. And
Right.
maybe when you go to Sunday school you can voice it or something like. No, but you didn't have these kind of close conversations with parents.
Right.
Anyway, sweetheart, that death thing, you'll see how eventually I really, really came to think. Now, I was doing well in school.
Mm.
Decided that I wanted to do a doctor. The nurses just had me saying, no, 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 nurses can't behave like that. They need somebody to teach them to behave better. And as I became a Christian, I was baptized. I remember the baptism. That must have been when my parents were away because I can't remember my parents being there, which would be strange. I must have been I must have been early teens, and I think I was at high school. But it was immersion by
Okay.
immersion, and I remember how happy I felt, how good I felt. I mean, I felt as if something wonderful had happened, and so on.
Right.
And then after that, now I'm thinking I want to go to India or some distant place and become a missionary and look after sick people and this kind of thing. I wanted to be a missionary doctor.
Yeah.
Anyway, when by the time we were again coming up to sixth form, I was doing very well. Um, I was like in the first 10 in the class. And boy, they had some Chinese girls. You see, you could study till you're sick. You can't get tired of
Right.
you study till you're crazy. You might
Yeah.
come third, you might come second, but you can't come first. Anyway, when I told my parents that I was thinking of medicine, the thing about it, there was no teacher in the school, the sciences, no science teacher. And so we could only do biology. We had a
Okay.
biology teacher, and I was doing excellent in the biology. I won the
Right.
prize for it and all that sort of thing.
Wow.
But when we finished fifth form, it was the first time that they started doing CXC exams.
Okay.
From school certificate, they were switching out. It was first year that changed to CXC. And I think I must have gotten 9 subjects. Or I think I got 9 subjects. I didn't pass geography. I don't know what happened there.
Okay.
But I passed all the other subjects, including Latin.
Wow.
Because if you
Okay.
were going to do medicine, you had to do Latin. So now, that after we finished fifth form, or just before we finished,
Yeah.
we got a science teacher. The principal was leaving, and this other lady came from London or
Yeah.
England, and she was a Bachelor of Science. And so they started teaching physics and chemistry at the school.
Okay.
And so we were the first sixth form who had to learn the physics and the chemistry in a year. That we were going to do an exam called physics with chemistry.
Oh wow.
And there were 9 of us who were thinking of medicine, and we had to try and do this. It was I can't tell you. Learning physics and chemistry in a year is not an easy thing. Anyway,
Oh no.
we went on, and out of that 9, 3 of us passed. Myself and 2 others.
Okay.
Indian girl who was she was very, Sankar was her name, and she came from a wealthy family and she was very bright. And the other girl Yvonne Harding, she was of us know, which was the boys' school that would be the opposite to the bishops.
Right.
But so you could imagine when you get into advanced level physics and chemistry with just one layer of some sort of thing. Naturally, we weren't doing well, and my marks were awful.
Right.
My father and mother had a meeting with me and said, a discussion when they saw my results. I said, Hazel, what is happening here? Tell us, tell us. I said, well, look, the problem is this. It's very hard because I don't know enough physics and enough chemistry
Right.
to be in a class like that. And that's why my father said, Hazel, why you don't just stick to the teaching and become a teacher? Because you're doing very well and you could teach biology.
Right.
My mother said, Percy, she wants to do medicine. We have to do what we can do to help her.
Right.
Hazel, what can we do, you think, to help you to improve? And I said, well, obviously, I think we'll have to be doing extra lessons. So they say, okay, they'll find out about it. So that's how now I started to do extra lessons in physics and chemistry.
Okay.
And so that is how I pressed on in the thing. And so when I came, it was rough. But anyway, when I came to the exam time, we did the exam, and this time I felt I was going crazy. Sometimes I felt suicidal, like all sort of terrible things.
Right.
But something that used to put me off. I had a friend about my age, and she lived. I used to met her when I was in Berbice, and she would come and visit me there. And some story with her I heard. She was an Indian, and some Indian boyfriend she had,
Right.
who was a different religion or something, and her father came in and told her, saw the young man there, the little young talking or whatever,
Right.
and told her, I don't know if he insulted the boy before, I mean, when I say insulted, talked about it before him or it's after he left. And the girl just picked up her bicycle. She got so crazy. She picked up her bicycle, jumped on it, rode to the steamer, which was she wasn't living too far from the steamer where the steamer took off. And when we talk about our rivers are huge, massive,
Mm-hmm.
the rivers you can't see the other side from one side.
Right.
And this is the Berbice River. And everybody who was there only know when you heard people bawling and screaming that the girl was riding her bicycle at a rate. And she rode straight off of
My gosh.
into the sea. And it was high tide. So nobody saw her, the bicycle, or anything after that.
Oh my goodness.
So when I heard this thing, I couldn't believe. And I said to myself, no, boy, that don't sound good at all. That don't sound good at all. Try to do your best you can
Right.
to keep your life going.
My goodness.
So what happened is when I did my exams now, I was able to pass chemistry, biology, and what was the other one? Chemistry, biology, and the physics I didn't pass at advanced level. So then they asked me, what would you do? I said, you know something? I can stay in school for another year, and then I could repeat the physics, and I could do botany and zoology,
Yeah.
right? So I went back to school for another year. And at the end of that year, now I did that, and I got the physics,
Okay.
and I got zoology, but I passed the botany at a ordinary level, right?
Okay.
Anyway, now I had 4 A levels and 2 O levels, plus my 9 subjects. Okay. By
Yeah.
this time, the University of the West Indies the University College of the West Indies had come into existence from like 1946, 1947, and I'm now 10, 19 going on 20, and that's the time now when they are looking for students. So they were offering exams for the Caribbean, that as if you are in a high school, they enter you and you could write the exams. And then they were coming through the islands interviewing people who I
Right.
suppose what the results were. So I happened to be one of the ones who was interviewed.
Okay.
I didn't get a scholarship, but I got a letter saying that I had a space. There was a place for me at at that university college. It was a University College of London, UCWI. It wasn't
Okay.
the university at the time. So I got us, they sent us in, I got us. In the meantime, my father was and mother, they were making a, because at that time you had to apply through the Ministry of Education if you're
Right.
doing medicine to go to some school abroad. And they were trying to get me into Belfast in Ireland. They
Okay.
were going through that thing. And
Wow.
then this thing came. And daddy said to me, here's what you're going to do. You want us to proceed with the Irish thing? Or you? I said, Daddy, a bird in the hand is worth two in the bush. I will take the bush. He said, well,
Yeah.
you know, this is a new university and this and that. I said, Daddy, I will go to university in
Mm-hmm.
the West of the West Indies. No, girl, just about that same time when they decided I'm making all the arrangements to go. Um, my father got very ill with this bleeding from his nose.
Right.
And I saw it myself.
Yeah.
And you take a when you take your hand towel and his nose started to bleed, the whole hand towel, was soaked with blood,
Yeah.
right? And everybody thought it's very unusual. But he was doing everything, looking okay and doing. I I know that he had to go to see the ear, nose, and throat specialist.
Right.
And before you knew what was happening, he was diagnosed with cancer of the nasopharynx.
Yeah.
And I recognize now that when I became a physician, that already he used to have these big lumps. You could see, but these glands were swollen here.
Right.
So the thing had spread.
Yeah.
Anyway, quickly, because said that they would send him up to London to go to the radiation at Hammersmith Hospital, which was the place to go.
Right.
And so arrangements were being made for him. I think he must have gone in June or very quickly. They tried to get him off, and that was the last I saw my father,
Wow.
because I wouldn't know that he was that sick that something dreadful is going to happen.
Right.
Anyway, he went off, and then mommy fixed me up and saw me off to go to University of the West Indies
Right.
in September, right?
Mhm.
August. So daddy was away and I came off and started going to university. And then apparently, which I know now, is when he went there, they realized that the thing was too far gone, it had spread and all that.
Mm.
And apparently they told him, Mr. Chung, if you want to die in your home land, you must go back now, because there's nothing we can do. And so he went back, and what I'm learning, David said they went to meet their mommy and daddy, and they couldn't recognize him as skin and bone. And
Wow.
mommy kept saying, "But he's supposed to come," and she herself was surprised when she saw how he looked.
Right.
Anyway, that was it. I'm at school now, and then the end of the I'm pumped. Daddy died in, I think Daddy died. I went up in 1954,
Right.
right? And I think Daddy died in December.
Okay. Wow. So only a few months.
So I was just kind of settling in and going on, and then I was in a class, a lab, and somebody came and said to me, "Oh, somebody's outside there to you. They would like to speak with you."
Right.
And I couldn't figure who that could be. Now, from I went up to university, I would go to church on a Sunday.
Right.
And that is how I met these missionaries. They
Mm.
were very, very good to me, and they really adopted me, I have to see.
Right.
And every Sunday I'd spend time, have a wonderful dinner there. They would rest, church in the evening, and then they drop me back to university.
Right.
So mommy apparently was able to find out that they would know me very well, and they were able to get on to them. And when I went out there, they said, Hazel, could you ask for an excuse because we have the mama sent a message to us to give to you, and we'd rather you come away and so I went and asked for an excuse away. And after I sat down there, I can't even remember how they brought up the I can't remember how they told me the news.
Right.
But I know that it came out that my father had died. Listen, Lizzie, I
Mm-hmm.
cannot tell you up to now
Yeah.
what reaction, except I was speechless. I know I never cried.
Yeah.
I was just speechless and in like I'm in a different space or something.
Right.
Anyway, they said to me, Hazel, are you going to be okay? And I said, yes, yes. I used to be very active with my religion. I belonged to the Varsity Christian Fellowship group, and we used to go down on a Friday to the home where they had the disabled children, that had polio, and some of them couldn't walk, and disabled people and so on. We used to go down there and sing choruses and go around and chat to them and so on.
Right.
And so they once I got back to the university, I thanked them very much, and they told me my mother would speak to me. And these people now, these no, I said I remember sitting on the floor and thinking, what next? I think I must have to go home. I'm the second in the family. My mother don't have no job. My father is dead. There's how much after us, and I don't know how I could finish this medicine thing. Anyway, I can't remember feeling worried about it. Thinking about it, but I can't remember feeling worried about it. However, they told me mom would call me and speak with me. Okay. When my friends from the Intervarsity Fellowship heard of my tale, of course they came every minute, they were looking, how are you, and so forth and so forth. They had prayer meeting for me and all this kind of thing. And then mom called me, and it was those days, phone call was very expensive, and you never phone, you wrote letters, right?
Right.
Anyway, mommy called and she said, very straight to the point, Hazel, your father died, but he died believing in his maker and his God.
Yeah.
And he said, whatever we do, we are to try and make sure that you finish, right? So
Yeah.
you don't worry about anything. Now, you won't be able to come to the funeral, but don't again worry about anything. Just do what you have to do, and we will be doing what we have to be doing. And don't worry about us here. We are going to manage.
Right.
And so I knew that the funeral would go on and all this sort of thing, right? Now, what I know after that is that the administrative department of the university, the hall I was in, Irving Hall, the administrator, he called me, and he told me they were going to ask me to write an exam, and also they were going to look at my certificates and all that.
Right.
So I did that, and then he called me to say that I didn't get a scholarship, but they would move me into second year.
Okay.
So I moved into second year, right? And that is where now anatomy class. I remember going to the anatomy class. The body was there, and we had about. I think the classes were small. I don't think there were more than about 20 people in the class,
Okay.
right?
And how old were you at this point?
I would have been 20, let me see, 54, 35. I went up, it would have been like 55, and I would have been 20, going 2021, something
Okay.
like that,
Okay.
right? So now I went into second year, and that's, when we started dissecting and the body I was on, Patrick, my husband, was on the
Yes.
other side of the body. I one side.
Oh,
But
okay.
we hello, Miss Chung, and we were introduced and so forth, and life went on. And I just knew that thing, and he was there, and there was nothing very special about our friendship. I was there trying hard to keep up and all this kind of thing. Anyway,
Right.
that is how life went on. And then we came to summer, and when I did my exams, I didn't get through. What was it? Physiology. I had to repeat something, and so I couldn't go home. I had to stay and finish to do an exam
Mhm.
again, repeat. And me and a group of us, we were there and we were studying and so forth and so forth. And we were really studying hard. And then did the exam and got through the subjects. I think I had to repeat physiology and I had to repeat anatomy.
Okay.
Anyway, whatever it is, repeating went on.
Right.
I got through, and then now I was on my way up to the university, up to the hospital, right?
Yeah, yeah, yeah.
So I had to now mommy had arranged through Booker's again for a grant, a government grant for me to finish. They
Okay.
they had to find the guarantors for me,
Right.
and they had arranged for me to finish. So I used to get they arranged, and then I would get a set amount of money every semester, and
Yeah.
I just had to live on it. And boy, it was rough.
I
It
bet it
was
was.
And let me tell you something. I don't know what it is. Sometimes you want to, my shoe soles, I can't buy a pair of shoes.
Right.
Sometimes I couldn't buy any clothes and my jeans and whatever. Anyway,
Hmm.
I can't complain. I never felt as if I never really felt as if I was deprived of anything.
Right.
I really
Yeah.
never felt that way. And the point is that I had this business of getting through, no worse than ever I must get through. And my father had said that when he had told my mother that when he went up there, the head of that radiation department was a woman. So his
Wow.
whole the way he thought about women and medicine changed.
Yeah.
And that's how we said to her, try and see that she finishes, right? So we went on, and I graduated in 1960.
Right.
And Patrick also graduated, but he had finished and started his intern 6 months before.
Okay.
So in 1960 was graduation, but as soon as I graduated, of course, I went home because
Right.
I had to pay the people back their money and so forth. I went home, and I remember how happy I was. I think I'd gone home this summer. I had some summertime, and I'd gone home this summer before, and that's when I first saw my mom since dad's death. She took me to the burial ground to see the spot where he was and so on, right? And then by that time, Patrick and I now had become friends after I went up to the hospital. And then we used to walk for coffee, have coffee, go back and study. And he used to keep saying, I'm not getting married. I said, I can't, even if I thought,
Right.
because money to pay back, and I'm the second of 9 children. And
Yeah.
my mother, by this time, mommy is doing a whole heap of different things to earn money, selling this and that. She really did a whole girl, you know about it. Right. Well, anyway, I go back home and I start my internship. And of course, you're very busy at the Georgetown Hospital. And I really was enjoying what I was doing and everything.
Yeah.
And the boys who used to be in my class at school, they had done like engineering and everything. And they finished long time and come back and work.
Yeah.
So a lot of invitations were coming to come on. I said, but anytime I get invitation, listen, internship is a thing that you are always on call. So there's no way. I just don't have any time to go anywhere.
Right.
So I really never saw anybody again. I just working. In the meantime, my husband, Patrick, now,
Yeah.
he is the one who kept phoning and phoning. And eventually I said to him, look, he said, you have to come back, right? And get engaged. I said, I don't have money. I have no money even to pay a passage to go anywhere.
Right.
So I don't know about it. He said, I will send the passage for you. I said,
Wow.
all right, you send it. But I don't have any other means of, I don't have any money, I can tell you that. When I went home, of course, I went to Ministry of Education. They told me, this is your salary. You have to pay this thing back. This is the percentage. I even said to the lady, you couldn't take, she said, when you're borrowing the money, you don't ask those questions. When you pay it back, you're coming to tell me how much you're going to pay back. No, my dear, this is what you are paying back, right?
Right. Yeah.
So that is it now. I had a lovely, lovely internship, really enjoyed what I was doing and everything. And Patrick insisted. So that is another joke. He didn't have any money either. Anyway, he went to the bank. He went to the Royal Bank of Canada to borrow the money. How many people heard that he was an intern? I don't know. I'm getting the money to borrow. Anyway, I think he borrowed the money from somebody else. I don't know.
Okay. Okay.
I know I had no money. So I only know that I came back up.
Right.
But somebody, he paid the money. Anyway.
Well, before you went back over, like to when Patrick got you like your ticket and everything, how many of your siblings were at home when you came back first for your internship?
How much what?
How many of your siblings were still at home?
No, right. That was it. I don't tell you that. From I left, I had no, my baby brother wasn't born when I was there.
Right.
Roderick.
Right.
Wasn't born when I was there.
Okay.
I think he must have been born because he was a year old when daddy died. Right?
Okay, yeah.
But after Joan came Richard, your dad,
Opa, yep.
David, and they say they were born in Georgetown.
Right.
They were born in Georgetown.
Yeah.
So in Berbice, it would have been Jennifer, Joy, and then Roderick. We were back in. Daddy had come back into Georgetown when Roddy was born. So it must have been. David says definitely his birth certificate shows that he was born in Georgetown. Okay. So the girls must have been born up in the country, and we were back again. And Daddy was able to buy, when they moved back, he was able to buy, and now again, a house with quite a lot of space and so forth. Right. So now there were 9 of us. Right. We had the 4 big ones, and then the 4 younger ones, and the 5 younger ones, right? Yeah. So after I came back, I got engaged, and I went to university, hospital, and I got a job in the emergency department. Okay. That time it was just a little emergency department. Everybody knows everybody. The nurses were so nice. Right. Everybody encouraging you and all that. And so I came back. Patrick at that time, was doing his internship. I think he was working with pediatric surgery or something like that. Okay. Anyway, I came back and we got married. I came back in July. We got married in December, 15th of December, 1962. And after that now, he was sent by the university. My husband was very bright. Yeah. Very bright, and he was an excellent surgeon. Very good with his hands. And he was sent, he couldn't decide what he wanted to do. And he was sent to radiology department. And look, apparently they needed radiologists, so they sent him there. But after he spent, I don't know if he spent as much as 2 months, he said, no. I have to see the patients and spend time with them. I don't like this. Right. So he quit that, and he then went down to, he left the university and he went to the government, and he was working at Jubilee, Victoria Jubilee Hospital. Okay. The hospital that does all the deliveries. Right. And they have a high rate of delivery. Yeah. So he went down there, and again now at that time they had very few anesthetists. Every time you go down, very few of everybody. There was very few of specializations there at the time. Okay. Right. But he loved he got to love the obstetrics and the gynecology. And that's when he now decided that's what he wanted to do.
Right.
Now, at that stage, I found myself, I had worked when I was up at university, having gotten married. I wanted to do dermatology, but I couldn't at the university because I was thinking no night duty and all that. But I couldn't get a space, and they needed somebody in anesthesia. So I didn't choose anesthesia.
Okay.
No, I didn't choose
Yeah.
anesthesia.
Right.
They needed an anesthetist. Couldn't find anybody, and that's how I got into anesthesia.
Gotcha.
When I got into anesthesia, of course, there's very few anesthetists. It was only me,
Right.
but I had very good specialist as anesthesiologists working with, right?
Right.
And I don't know that I seriously thought of doing anesthesia. It was kind of nerve wracking, watching looking at them putting the patients to sleep and saying to yourself, Lord, you have to be responsible for these patients, and you know, I
Right.
wonder how you can make sure they're going to wake up.
Right.
Anyway, anyway, when the year was finished, I was looking to leave, and the consultant who was from Barbados, very very good anesthetist. He said, "Hazel, you've been here and we can't find anybody. Just stay." So that is how I stayed on in anesthesia.
Okay.
And having stayed on in anesthesia, Patrick now was looking to go and specialize, and he got a Commonwealth scholarship, which was going to take him to England.
Wow. Yeah.
So now I would be going with him, and by this time I had moved from university to hospital to government
Yeah.
as well. Well, would I like to tell you this? Patrick was learning anesthesia. I just learning anesthesia. I'd worked in at university and come to. Sometimes they have to anesthetize the patient, and one of them is to anesthetize the patient because they can't get an anesthetist, and the other one do the surgery. So
Yeah.
he's asking me, here's how you do this, here's how you do that. And I am teaching him anesthesia so that he could anesthetize the patient when, the patients cannot wait, because when you have to do a cesarean section, you need to do it.
Yeah. Right.
Anyway, thing about it is we reached a point now where Nicole had been born by this time.
Yeah.
She was 50 months old, and he got a scholarship. So we are going to England. So we had to leave her, and we went off to Britain.
Okay.
It was about, when we went to Britain, it was on Boxing Day.
Mm.
And she was born in 1965.
Okay.
So it would have, she was not two as yet. So it would be 66, right? End
Yeah.
of 66. So when by the time we got into Britain in January to be 67,
Okay.
right? So what happened now is I was able to, in those days it was easy to get from country to country and this kind of thing.
Right.
And the government gave me a scholarship because they were so short of anesthetists, they needed somebody to be trained. So although I'd only worked for a year, they said, okay, now I have to tell you that the doctor that I worked with, Dr. Ivor Campbell, God bless him in his grave, he was a very bright person, and he was an excellent anesthetist.
Okay.
But he looked at me the first day I reached there at KPH, and he said, Dr. Chung, I come to work at 7:30 every morning.
Mm-hmm.
I leave here at about 12:30. If you have anything to discuss with me, we will discuss it before I leave.
Okay.
I have a telephone number, because at that time you didn't have beep and the things to get you. I have a telephone number. If you reach me, you reach me. I'm not sure that I'll be coming. I'll give you instruction or whatever. I looked at the man, I could not believe, because the KPH is a hospital where you get the worst things happening.
Right.
All the stabs, at the time they didn't have much guns. So it was all the stabbing and all the rock throwing and, the terrible things that came.
Right.
He said just that. And that is exactly what it was. So you knew that use all that you know
Right.
to do what you can, and whoever's around who can help you at the time. Okay? And he was the only specialist, they didn't have any more.
Wow.
Right? They never had no IC at that time, no intensive care was available. They had no
Right.
means of, I don't think they had no ventilators and all those kind of things at that time. Anyway, when you were on duty,
Mm-hmm.
you covered KPH, Kingston Public Hospital, you covered Jubilee, and you covered Bustamante Hospital. So you were
Oh,
running from
wow.
you're running from hospital to hospital. Okay.
Yeah.
And that I had done for a year, and I tell you, they gave me a scholarship and the like. But I had naturally I got a lot of experience.
Oh,
So
yeah.
when I went up to England, the kind of experience I had only in a year, the English doctors didn't have that, but they had got a lot of academia, which I didn't have.
Right.
So of course I had to get my books and I had to just study. Anyway, next thing is I'm pregnant with with Nigel.
Nigel, yeah.
Nigel was born in the December. And so I thought the world was coming to the end. No, I don't know how I'm going to do this and all that. And my husband, Patrick, he was there, and Patrick is coming. You know, British newspapers go on and on and on forever. And he is there sitting. And I'm saying, by the way, when we went to England, none of us could cook properly.
Okay.
I don't even know. None of us could cook. We just had to learn.
Okay.
Because that's the other thing. When we got married, none of us could cook. We had to carry his helper, as you know, from our childhood. She went with us on our honeymoon, right?
Wow.
So that
Wow.
we could get food to eat. Anyway, here we arrive now, and I am having to keep the place tidy, go to my lectures. Thing got to me, and I threatened to kill him. I said to him, look here, this cannot go on. Do you know that I can kill you in here? And he said to me, how you would do that? I said, the kitchen have knives, you know. Nobody's interested in us. Not a soul is interested in us here. They don't care whether we live or whether we die, right? Nobody will miss you. He said, then if you kill me, what would you do with my body? I said, oh, you know, there's a bridge. The Thames, the River Thames. There is a bridge, right? Not too far from where we live. And that would be a good place to throw your body. He couldn't believe that a Christian person could be talking like that.
Right.
I must have been going off myself. I don't know. Anyway, the thing about it is that after I went on like that,
Right.
he started doing things. He started hoovering the place, and then he would say, "Come, I'm going to take you to this market that they had, that where they sell that Jamaican things, so that we could cook." So we learned to cook by that time. Oh, he had more time than me, so he used to cook stews.
Okay.
On a Saturday when I had to go to classes, and I had two other friends. One had a car, and so they used to come out every Saturday, and so he would have this stew ready for us and everything, and we'd have a nice meal, and then all of us would start cussing the English people who don't want us to back to beside us, who tell us this, who doing that, how we racially prejudiced, how these people this, that, and the only one with the car is the one who everything he was seeing. We say, but you are not riding in a bus, you are not riding in a train.
Right.
So no wonder you don't see anything, and you telling us how the people are so nice.
Right.
We have to stand up in a line and they come in front of you and you can't even open your mouth to say anything.
Yeah.
Right?
Yeah.
And so every single Saturday we end up letting go of our feelings by cursing these people. And of course, by that time, they bring some pimento liqueur, and who don't drink the liqueur. So your mouth is open now to say whatever you want.
Right.
However, this thing went on, and then Patrick got through his exam very quickly. He came into London, and so we had a flat there and so on. And he could have gotten a very good job, but he was traveling in the train, and some train was packed the evening, and somebody called. They started making fun of him. He was the colored man, which was him.
Right.
And he came home so mad and said he's not staying in England. He's going back home, and even if it's Timbuktu to send him to do his job, he is going. He is not staying in the country. It will send him crazy.
Right.
So the decision was made for him to go. And my mother, I wrote to her, I didn't know what was going to happen. But it happened at the time that Bernice, my sister, the same
Yeah.
one I told,
Yeah.
she had married a doctor too. And
Right.
he was in England specializing in internal medicine.
Mm-hmm.
And I can't remember if he had actually finished and or it must have been almost finished. So mommy had come up because she herself had small children and so forth. And mommy had come to stay with her. I sent for mommy. Mommy said she could stay with her and help her, and then come over to me when Nigel. So that's it. Mommy came, and she stayed until Nigel was about. He must have been about, I think, about 5 months old. And then she brought him back to Jamaica, and I stayed on and finished. By that time, I had passed the part one. I'm just waiting to do the part two.
Right.
And so that is how it went. Mommy brought him home, Nigel, and I went on. I moved out from the. By that time, the people who we had lived near to got to know us, and they started speaking to us. And by the time we were ready to leave, they say, "Oh, they're going to miss us." And Patrick was the one, we'd love to know. Every morning we're going down. Good morning, no answer. Good morning, no answer. I said to him, "You're not tired of that good morning business and nobody's answering you?" He said, "No, man. They're going to answer eventually." And
Right.
he and the people became very good friends, my love. One little old man that used to live out there, they sit down outside with I think he might have been in a wheelchair with something was wrong with his leg. And the lady down the bottom who used to sell all the fruit and thing and so they became good friends when she win lotto. She called him and tell him how much lotto she win and all that. Anyway, so despite that, he said he was going home and he came home to Jamaica.
Mm-hmm.
And then Leighton came, not Leighton, Nigel came home.
Yeah.
And I finished. And when I sent to tell them, I did my exam I did the London exam and I didn't get it, the second part. But there was an Irish exam. So I traveled to Ireland a couple months later and I did it and I passed. And then they sent Dr. Ivor Campbell. He said, "Why you don't just stay and do the exam again?" I said, "No, no, no." I said, "No, no, no. I am not an academic. I am a worker.
Right.
I have gotten what I want and I am coming home and my family. I need to be back with my family." So I came home in time for Nigel's birthday,
Okay.
right? So Nigel's first birthday, I was here to celebrate. And then they had said that Nigel is a very good baby. So they put him down in his the little crib place where he
Yeah.
would just stay and just as long as you fed him and so forth. If you're not motivating, just sleep, crawl
Yeah.
around. So when I went home now, they were telling me how he not doing it, but he wasn't being motivated. So when I went home now, I had him up a walker. I had him up and down and with the books reading and anyway, that is what happened. And then when I went to the hospital, um on New Year's Day, they said, "What are you doing here on New Year's Day?" It's a holiday. I
Right.
said, "I know, but I'm supposed to start working on New Year's Day, so I'm here." They said,
Right.
"Well, you might as well go home because nothing is happening and somebody else is on emergency." When I went back on the second, they were happy to see me back and all that. And then now, by that time, I think they were the Dr. Campbell, myself. I think I'm not sure if the other doctor was back as yet, or if he came a little bit after me. I'd stayed on for some. Anyway, the thing about it is, I think he was the specialist, and they had a couple other people who had diplomas who were helping. Then now they were going on with this thing when you are on emergency duty. The
Yeah.
same three hospitals calling. Now none of them liked children, and I discovered later on a lot of adults, especially maybe the men, would rather not have to deal with children on a daily basis. That
Right.
is true,
Right.
right? But I discovered that because the equipment and the whole method of answering was different,
Right.
they didn't like managing children. And they had sent to tell me this from I was in Britain. So I was going to a hospital I think I was going to Westminster Children's so I could get the experience. So I was quite ready, and I like children.
Right.
So now they used to send me, the children had to be waiting, they were the last to be done.
Mhm.
And so then when I went there, the head of the hospital begged me, do let them send you here because we really need somebody to look after you. So afterwards, I said to them, when they keep phoning me, I said to them, look, that by this time, Lizzie, I became very feisty, as they would say in Jamaica.
Right.
I now had my specialist degree. I had suffered greatly in Britain to get it.
Yeah.
And I had come home saying to myself, nobody is going to push me around.
Right. Yeah.
So when I came back, I was kind of, you know, just go gently with me.
Right.
So when they called me, I said, after about a month or so, I said, listen, make up your mind. What do you want me to do?
Right.
I am not going to be running from one hospital to the other. It's either you want me back at KPH or you want me at Bustamante Children's with
Right.
the children. But this business of running, they said, okay, whoever it is that make decision, say, okay, you want to start children, start children's.
Right. Yeah.
So they did just that, Lizzie. They put me at children's and it was me alone. Morning, noon, and night, holiday, every day, every day. Morning, noon, and night. Nobody is coming there beside me.
Wow.
So I got my wish, but boy, it was very hard.
I bet it was. Yeah.
Being on duty every single day of the year,
Yeah.
every holiday, being called and all that. Anyway, as you and I would know, God knows when He wants you in a place
Yeah. That's right.
because somehow He maintains your spirit, and although it is rough, you stay. You don't walk away. Although you might set off and go on, you stay.
Right.
So I was there for one whole year. I think they had two doctors, two ladies who had been carrying on, but they didn't have specialist degrees. They had diplomas. And this is how government works. If they bring somebody, they will move everybody
Yeah.
because they are always looking to see how they could not get rid of, but don't want to pay people money.
Right.
Anyway, the thing about it is that I stayed there. That was from 1970. And I was able to build a unit now. There was no anesthetic unit. I was able to build an anesthetic unit. And when I reached there, what do you think was happening? They had talked about intensive care, and the friends of the hospital had decided to build an intensive care.
Yeah.
So I had just come and by the time I got there, they had just come to find the space to put it in near to the operating room,
Right.
and they started building. So that intensive care opened 4 years after I was there, 1974.
Okay.
And then the Pan American Health Organization sent me on a fellowship to the States.
Yeah.
And I went to Michigan University, Philadelphia University, and Boston University, children's hospitals.
Yeah.
And then I was able to look at the intensive care units, go to theater with the doctors who worked in pediatrics and so forth. And then when I went back home to Jamaica, I was able to start working at building and getting the staff and so forth for intensive care. So the first children's unit in the English-speaking Caribbean was the Bustamante Hospital, and that was opened in 1974.
Wow.
Right?
Yeah. Yeah.
Yes. So that is it. The training of doctors, they only allowed with the exams that they had, they would only allow them to. They started doing the specialist exams at the university hospital.
Mm-hmm.
And they only allow them 6 months. They come to the pediatric anesthesia hospital for 6 months, and then they have to move on.
Right.
So really, it was very hard to keep anybody there. However, my love, what I was introduced to nurse anesthesia.
Yeah.
Now, I didn't know anything about nurse anesthesia.
Right.
And it's when I got to Bustamante Hospital, that is the time I realized that there are a lot of hospitals in Jamaica, little hospitals all over the island,
Right.
in places where the roads were terrible.
Mm-hmm.
You could only depend on train at the time to pass by.
Right.
So to get blood to the place and all that sort of thing was a problem. And if you had an emergency, somebody had to be able to anesthetize the patient. So it's the nurses that they were training to do that. You see?
Right.
So the thing about it is, one doctor from Spanish Town, where Patrick was eventually, he was the head of that hospital.
Yeah.
The one doctor from there, he went away and saw in Philadelphia where they were training nurses. And when he saw how the nurse anesthetists operated and so forth, he came back and told the government about it.
Right.
They said they weren't ready for that, right? And the doctors, remember that anesthesia is one of the last specialties to be recognized.
Right.
So the doctors were not taking on anything that was going to push them further back in time than to get recognition. So they didn't take on with it either. However, that same doctor, Dr. Freeman was his name, he approached doctor in Philadelphia and asked him whether he would train a nurse anesthetist for Jamaica. And the doctor said yes, sure. He was training for America, so that would be all right. And so there was a nurse at Spanish Town Hospital who wanted to go, and she found the money, which was a lot that time. Well, I understand it was about 3,000 US, which was a whole heap for her. But she was able to find the money, and so she went off and did the training. And when she came back, the whole anesthesia system was improved at that hospital.
Right.
Because could you imagine what was happening before when you had nobody trained?
Right.
Right? Now, at that time, even the agents were different because they were using mainly ethan chloroform.
Yeah.
Right? And the masks and the drop in business. But as you know, or will know, is that a lot of great advances took place. Monitoring was minimal, but now you have excellent monitoring, very, very modern agents.
Yeah.
And the whole thing of the whole anesthesia has improved.
Right.
So that the safety of giving an anesthetic is very, very much greater.
Right.
Okay, I mean, people don't think of, even if the worst things happen, you don't think of patients dying. You know, you feel that you have all that is available to bring them through. Of course, you know that it's just something you're trying, but it's not going to work.
Right.
Or you want it to work. Anyway, the thing about it is that the chief nurse or one of the nurses who went away and trained came back. I think the training was for they used to train for a year and a half, something like that.
Okay.
And when she came back, she had a vision. She looked around and she saw where there would be a great improvement if they trained the nurses who were out there who were giving anesthesia anyway, right? And so the government started training, and I can't remember how much they trained, either about 9 to 12. It might be as much as 9, as 12. But they trained at least somewhere between 6 and 9 nurses. And the anesthesia became much safer in the various places.
Right.
And then she realized that you can't just train and leave. If you train people, you have to continue to educate them, and they need to know what's happening, what's new, what is happening with the patient, how you correct things that went wrong and so forth. So
Right.
she started making sure that she could find a doctor who would take it on. And so she was led to me. That's how I got into it.
Mm.
She realized because she had met the other doctors and she realized that I looked like the one which would take on the problem. And so
Right.
she came to me and she died just recently.
Mm.
It couldn't be more than less than 6 months. But she died just recently. But she was a very gracious lady. She had a vision and she really put her life all into the improvement of her specialty of anesthesia.
Right.
And she didn't care if she was left behind. And whoever else she chose went ahead.
Right.
Her name was Mrs. Denny. So Sister Denny, as we used to call her, she is the one who had the vision. And so she literally spent her life establishing nurse anesthesia as a specialty for nurses. And in fact, she was able to get into open a school specialty in the government service called the Jamaica School of Nurse Anesthesia,
Yeah.
which was just opposite Kingston Public Hospital in a administrative buildings section that they had there. And so when I had started helping them from before, from the 1970s, they sent a hope ship from a hope ship. Actually, they did a survey from the university which showed that there were very few anesthetists. There weren't no any more than 20. And then the majority of them were at the two big hospitals and in the immediate surroundings. And all the others, whether they were medium sized or small,
Right.
were using nurse anesthetists.
Yeah.
So the next thing that happened was
Yeah.
Fidel Castro visited.
Mm.
And when he visited, he offered technology training. And the head of the Nurses Association at that time had her doctorate. And she had a thing about doctors. She had her doctorate, a PhD, right?
Right.
She just did not like doctors. That's
Okay.
something, for whatever reason she had this.
Yeah.
So she, however, was very vocal and everybody knew her, one of those type of people.
Yep.
And so she was able to convince them that there was a shortage of anesthesia and they had anesthesia training for nurses in Cuba. So she would like them to send 5 nurses.
Right.
And they agreed to that. The government, the Ministry of Health agreed to that.
Yeah.
And the chief medical officer at the time was a doctor that I knew very well, right? He was a neurosurgeon, the first neurosurgeon we ever had. And I was driving down in my car to work and I heard this thing on the radio. I couldn't believe it because nobody had told us anything about it.
Right.
So as soon as I got to work, I called the Ministry of Health and asked to speak to him. I said, Dr. Johnny, did I hear right? Is the Ministry of Health sending 5 nurses to train in anesthesia in Cuba? Yes, he is. I said, Dr. Johnny, who is going to monitor these nurses when they come back? You. I said, no, Dr. Johnny. You cannot ask me to monitor people who I don't even know what their training was about.
Right.
Hazel, you will have to, because you are the senior government anesthetist. I said, no. Tell me something, Dr. Johnny. Why is it you need to send these nurses to Cuba? We have the University of the West Indies that has specialist anesthetists. We have the government services has a specialist anesthetist. We have the nursing body which has its training thing. So why is it we can't set up a school here? Well, nobody ever thought of it. So I said, well, I really think you should think about it now.
Mm-hmm.
And so that is how they thought about it,
Yeah.
and we got the various specialists from the specialist universities, and that's how we got the nurses education department to come with us. And so that is how we sat down and worked out that we could do the thing here, the program. We worked out the program, and that is how the school started.
Wow.
So
That's
the Jamaica School of Nurse Anesthesia was
yeah.
opened in 1984.
Mm-hmm.
And since that time, we have trained, we trained about 100 and, I think we trained about 126. And they were not all, because they were not all Jamaican, because the year after we opened, Pan American Health Organization came to look for me and said, would you be willing to train nurses from the smaller Caribbean islands, because they do not have, or if they have, it's just one doctor,
Right.
and therefore they really need some help. So that is how now we started training for the Caribbean islands.
Okay.
And we have trained for the Caribbean islands, all of them. St. Lucia, St. Kitts, Dominica,
Right.
you name it.
Yeah.
Every single one of them. The only ones we don't train, we haven't trained for, are the bigger ones which have enough doctors. Trinidad,
Right.
Barbados,
Yeah.
we haven't trained for them.
Okay.
But all the others,
Okay.
we have trained for, okay?
Yep.
Including Grand Cayman.
Okay.
They sent one nurse, right? And now apparently they have enough doctors, so they haven't trained any nurses. But if they need a nurse, then they would call to Jamaica to find out if anybody is available. So I don't know, it must be about 11 or all of them. Every single one of them, we have nurse anesthetists. And then we would go back every 4 years or so to see how things. Girl, when you go back and you see the improvement it has made
Yeah.
for the specialty of anesthesia, you feel, boy, I've done something.
Yeah,
You
that's
know?
what I was going to ask you. Like, how does it feel to be like a pioneer of that? I bet that just feels like so rewarding to you to have been.
Very, very,
Yeah.
because let me tell you, I have been fortunate to live to see results.
Right. Yeah.
I have been able to live. So when I remember the years before and
Right.
the struggle it was to get to where we are,
Yeah.
I feel that my life was worthwhile.
Right. Right.
When I go to the Caribbean, you want to see how they greet me in the hospital.
Yeah.
You want to see how they greet me because of the differences I made to their anesthesia practice in the hospitals, right?
Right.
And then we always wanted the program to become a master's, because at that time they were training for 2 years, 2.5 years, and then we extended. No, it was 2 years, and we extended to 2.5 years. 6 months internship was always included in the time.
Right.
And then we always wanted it to be a master's, but boy, nurses against nurses.
Right.
Nurses, this is Lizzie and me having a podcast. Nurses against nurses. You understand?
Yeah.
They never liked the nurse anesthetists because, according to them, how much money they were making, how many big cars they were driving, how
Right.
many this, how many that. These girls, when they graduated, were doing a lot of emergency work
Yeah.
because it was necessary. Let me tell you, if you are a doctor, you have trained for 5 years, you have to spend about 7 years before you can become a consultant. Do you
Right.
want to be awake for them to say, come and give an anesthetic for me to do an incision and drainage of an abscess, or to pull a fracture or something like that? No.
Right.
So I realized that I wasn't willing to do that. So let me train the nurse anesthetists who would be able to do that sort of thing.
Yeah. Yeah.
So that is the story now. The program, I worked with the government, retired after my 25 or how much ever, 25 to 30 years
Right.
in 1995.
Yeah. Yeah.
And then I started doing a private practice. And they called me from the ministry to ask me, would I take on the nurse anesthetist program full time? And I said, sure. because nobody else wanted it. Anyhow, you notice it's a job that I am always doing a job nobody else wants.
Right.
Anyway,
Gotta do it.
I then joined that and I worked renewing my contract every 2 years until 2015 when the school closed because the government decided, Ministry of Health decided that they must send all the teaching programs to a university.
Yeah.
And so the program was moved to University of Technology because we realized that we have a major clinical aspect to our program.
Right.
And it is a master's program.
Yeah.
So at the moment now, I went with them and started the program up there, revised the curriculum and so forth to fit in to give us the necessary credits. And so there I am still now. Can they find somebody to replace me? I thought every year I'm saying, no, I've had enough. No, I've had enough, right? And every year, the reason being, the university pays bad, the pays poor.
Right.
All the nurse anesthetists who are there are earning more money in the jobs they have. So why are you going to think you're going to get them leaving their job to come to do something that they're going to get less money and benefit? See? So they're having a hard time. But I keep telling them from 2015 I started, and now they've graduated about 4 sets.
Yeah.
They need to find, and the other thing about it, it's a program where you do not have a bachelor's before, is the nurse, the bachelor's they have is in nursing, not nurse anesthesia.
Right.
So it's very difficult
to
get them from that to that bachelor of anesthesia stage.
Right.
That first year is very, very important.
Yeah.
And then they start into the theater and you've really packed them up with a whole set of academia that you're hoping that it would, when they see things happening, it would make sense.
Right.
So that's where we are at That's where we are at now.
Okay, gotcha. Yeah, I always find it interesting to hear about like your upbringing and everything like that. Now, actually, I do have another question. When this is all like going on and stuff, were you still like writing to your mom and stuff, or like calling her and stuff and like updating her on this stuff? Like, was she calling you and wanting to hear about the work you're doing with that?
No, my mom?
Yeah.
No, my mom, let me tell you. When I saw my mom, when she was before she had the dementia and so on,
right,
she would ask me, how I was getting on, and she was happy to hear that things were progressing and so forth, and she would encourage me. But she really never got into the details. She just knew I was doing well and so on. She came to Jamaica actually, and I don't think I ever took her to the hospital, though. I don't think I ever took her to the hospital. She came to Jamaica, and one thing she did say to me, she said, Hazel, I see how well all of you have done.
Right.
But the truth is that I like the way that I was brought up and I managed, because with all that you all have, it seems to me that you're overworked, and you seem to me as if you're overtired. That's what she said.
Right. Okay.
That you have done so well, but no.
It's
not for me.
Yeah.
Not for me.
Okay, gotcha. Yeah. So I also wanted to ask, like, to kind of close out and stuff, now that you've given us your story and like all the encouragement through it, if you had any like pieces of advice, like if you could say like one thing to like me entering into my, like going into hopefully into my medical career, like medical school and stuff like that, if you would have any piece of advice for people that are getting ready to like embark on that kind of journey.
Roberta, yes, Roberta is here. She's in medical school. She's looking to go back to finish and start her internship. But listen to, as you see with my life,
yeah,
I had not planned anything.
Right.
I had not planned anything. I believe at this age of my life that in truth and in fact, God creates us for a work.
Right.
And it's you see it in the Bible in Jeremiah and I think it's Isaiah where it says from the time that you were born or some before you were born
Right.
that you were created for a specific thing.
Mm-hmm.
And I could only think that it is true in my particular case. I don't know about other people, but I believe that this is true because I didn't choose, as you see, to do anesthesia.
Right.
I was led into it. And then I wasn't chosen to get into what I've gotten into because I didn't know how that would work. I'd had nobody to tell me before. But as I did certain things, I saw things improving,
Right.
some good coming out of it, people benefiting, patients getting better treatment. So it moved you to move on again.
Yeah.
And I do believe that, especially with medicine, you must only do medicine if you really, really want to be to do medicine because medicine is a giving thing. It's
Right.
giving, and you don't know if you're going to get back anything either, right? And it's not a money maker. I try to say, I never thought of money. I never ever thought of money when
Right.
I went into. I started out with I'm thinking of a missionary type of thing, right?
Right.
And also, even in my daily work, I never liked private practice. I always wanted to work with the poor people,
Yeah.
right? I always wanted to work with poor people. And it gave me a lot of satisfaction, you know. And I could see, when I realized some of them come so late and they said, no, 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 you're too late. We'll have to cancel. Because I said, no, no, we will go on because they have to take the time off. They have saved the money to come on whatever transportation. And it's hard for them to do this a second time. So
Yeah.
true, they shouldn't be late, but we have to do it. We can't make it because that is going to be too hard for them again. So the thing about it, and sometimes too, that you can give advice to them about their own setup and so on,
Right.
And I I personally feel that you have to even if you are thinking about it, you have to be led into the thing because you do not know what the environment is going to be. You understand?
Yeah.
And listen to me, life is like this. You're going to find people who are going to say all sorts of things about you, people who think your work is wonderful, people who couldn't care less whether you came or went, you know. And you have to learn to live. This is the thing about anesthetists. In one day you are set in the theater, but you see so many different surgeons.
Right.
And you yourself, yeah, you know who to be very careful with. You know who you can make a little joke with, and you just do your work with others, and that's it. You don't think. So you learn how to deal with people's personalities,
Right.
and then sometimes you're able to help some people.
Yeah.
They're willing to listen to things that you have to say, and you're willing to help people.
Right.
And there's some people, no, you just do what you have to do, and they do what they have to do.
Right.
Okay? And you also learn that if anything happens to the patient, surgeons not taking any they have anything to do with it.
Yeah.
First thing they are looking for is what did you do? What did you give them? What did you
Yeah.
the anesthetist is always the person who they are looking to lay blame on.
Right.
Understand? So you have to be very careful.
Mm-hmm.
You have to be very careful and you have to be very meticulous and you have to be able to know how to deal with people because even when they get on your nerves, sometimes things would happen and it hurts you so much. You feel as if you just want maybe a few tears, but you just wipe it away and forget about it. You
Right.
can't say anything. You have to wait until everything has passed, finished. And if you're really, really still on your chest, you have to wait for that time when you can see the whoever is involved, and you just say, "I'd like to say something to you." So
Yeah.
it
Yeah.
teaches you also how to kind of stay calm and control yourself in the
Right.
situation, you know. But I don't even know how people, you want to go into medicine, but medicine has so many different specialties now that you can get into,
Right.
right?
Right.
And I don't know how people make that decision. I made mine because I just found it. I found
Right.
myself. Patrick made his because he loved what he was doing,
Right.
right?
Yeah.
And so I think it's an individual and very personal thing
Right.
about thing. And the other thing I didn't know, do you know what I learned? My father wanted to be a doctor,
Okay.
but he wanted my brother to do medicine.
Mm.
But he just felt a girl couldn't do medicine. You'll get married, then such a long thing, you spend so much money, you don't practice. He must be laughing like anything. It look like if I can't leave it now. You
Right.
understand?
Yeah. 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 That's right. I guess yeah, I guess that'll be something. I haven't like obviously, worked in a hospital very much. Like I've done some shadowing and like with my dad being sick and like being in the hospital at that time is getting to see like a little bit of interaction between different like doctors and like between the doctors and the nurses and stuff like that. But yeah,
Mm.
that'll definitely be an interesting thing, something that I'll definitely be praying about, that God help me to hold my tongue when I need to hold my tongue and to speak when I need to speak. Like
Yeah.
my so yeah,
Yeah,
I'll,
my Patrick used to say to me, you talk too much.
yeah.
Your problem is you talk too much.
Yeah,
And
yeah,
that is why you get yourself in problems.
right.
That's what he used. Yes, yes, yes. So that is not but you know something, although it has been so difficult and so on, I would do the same thing again.
Yeah, yeah.
I would do the same thing again.
That was kind of like those were the main things that I wanted to hit on and like to ask you. So I want to say thank you for your time and for being willing to do this.
Pleasure, pleasure.